Hi, this is Dr. Sharath. I am working as an assistant professor in Department of Neurology, Kasturba Hospital. So today I am going to be speaking about epilepsy. What is epilepsy? Epilepsy is a common condition, can be found in any age group. In this condition, they will have increased predisposition to have recurrent seizures. So what is a seizure? A seizure is nothing but abnormal excessive discharge of electrical activity of brain. So wherein a patient can have a multitude of symptoms. These symptoms, they can vary with the part of brain involved. There is something called generalized epilepsy, wherein a patient might have generalized twitching movements of whole of the body. Patient might have fall with tongue bite and frothing from mouth. This is one of the common epilepsies where patient might injure himself or the others. So there are also other types of epilepsies called focal epilepsy, wherein a patient might have some abnormal sensation in the form of flashing of light, tingling sensation of any part of the body, or any abnormal sensation in the stomach. Following this, they might have a staring look or any other twitching of any one part of the body. There is also one more epilepsy called absence epilepsy. This is seen commonly in children, wherein they might have brief episodes of staring look with listlessness. These episodes can be very frequent in children, and they can be also missed in children if parents are not paying close attention. What is the cause for this epilepsy? There can be a multitude of causes, like any stroke or any other past brain injury due to any road traffic accident or due to any neuroinfections. Sometimes even after extensive evaluation, we might not find any underlying cause. At that time, we term this as idiopathic epilepsies. So what are the things we should do if anyone develops a seizure in front of you? So first thing is we should make sure that the patient is protected from the environment. So we should make sure that patient should be moved. If he is in the road, we have to move him to the pavement. If he is near some electrical source, so we have to move him away from that. If any sharp object is there, we have to move him away from that. And we should make sure that something like a metal object and all should not be given to them, so that they can injure themselves if it is sharp. And one more thing is we should put him in left lateral position, that is turn him to his left side and make sure that he doesn't aspirate on his own saliva. So even saliva and tongue also can go into the throat during these episodes, and this might cause harm to the patient. And we must also not put any objects like any cloth or any spoon during these episodes. And one more thing is, whenever the patient is made safe by putting him in lateral position and moving him to a safe environment, we should also, if one of the bystanders is free, they can record the event in their mobile phone. This might help your doctor in making a diagnosis of seizures. What are the things we should do if a patient is having seizures? Usually the seizure will subside on its own by 1 to 2 minutes. If it doesn't subside by 1 to 2 minutes, if it is going more than 2 minutes, patient must be taken immediately to a local doctor so that it is treated as an emergency. And if the patient is already had seizure and he presents to doctor, they might do some investigations like some blood investigations, imaging in the form of any CT imaging or MRI imaging. They might also do a test called electroencephalogram, wherein we measure the electrical activity inside the brain. This is so as to determine the cause for your epilepsy. And what are the things, some certain do's and don'ts for a patient with epilepsy? Once you are diagnosed with epilepsy, they will be put on medications. Most of the epilepsies are treatable with medications. It is around 70 to 80% at least will be managed by medications. However, some 20% might need something called epilepsy surgeries also. So once the patient is put on medication, they have to continue the medication for at least 2 to 5 years, and these medications should not be stopped on its own by the patient. And one more thing is they have to maintain adequate sleep and should avoid driving vehicles or swimming for at least 1 to 2 years after the last seizure. This is so as to prevent any injuries to patient himself if he gets seizure during any of these events. Thank you.